Hello everyone, this is Kevin from Center of Balance, and we are getting ready for our daily health talk. So today's topic, we're going to look into the knee, okay? So I will be doing a talk especially on knee conditions or knee pain or knee discomfort. So if you're interested in this topic or you're experiencing knee pain, please take some time and listen in. This is going to be very helpful for you. All right, so let's get started. So we're going to talk about knee pain. So, knee pains can appear out of nowhere. So, like all of a sudden, you're just starting to have pain in your knees. It can be through many different reasons. So today we're going to look at the Western medicine's perspective and the Chinese medicine's perspective on knee pain. So the knee actually consists of many parts. So these parts like the ligaments, the tendons, what else is there? You have cartilage in the knee. You have the lateral condyle, condyle, and you have the posterior cruciate ligament, you have anterior cruciate ligament, meniscus, patella, and the patellar tendons that connects the patella, like the kneecap, to the muscles as well. So it's a very complicated structure. So when you have knee pain, it could be due to these parts, like the parts I mentioned, the muscles, the ligaments, the tendons, the patella, and being stretched out, worn, or aggravated, or partially torn, or ruptured. Okay, it could be a number of reasons. So it doesn't really take a traumatic blow or hard fall for your knee to become injured. Why knee issues occur. Okay, so the first one is fracture. So a fracture can cause some knee pain. So when you have a fracture, it causes, in the knee, it causes swelling, sharp pain, inability to move your joint. So if you look at this structure, so the fracture can occur between the shin bone. Okay, so this is the shin bone, excuse me, this is the shin bone, which is also called the tibia, or between the kneecap. Okay, this is the kneecap. So a fracture can occur in these two places. Okay. A broken kneecap can also occur, causing intense pain and swelling. So fractures that involve these bones can occur from traumatic injuries or simple falls. Next, tendonitis. So the tendons connecting your joints, the tendons connect your joints to your bones. So as you can see, this model doesn't show all the tendons, but then you have this big tendons that connects the kneecap to the muscles. Okay, and you have what else is there? You have these ones you can see are actually ligaments, okay? So not all the tendons are shown on here, because if you have tendons all over, it will be too complicated to see clearly. So repetitive actions can cause your tendons to become inflamed or swollen. And so these can be activities such as walking or running too frequently. They can cause your tendons to be worn. So this condition is called tendonitis. So tendonitis of the knee is fairly common. Oftentimes you feel tightness, swelling, and a dull ache. These are the signature symptoms of a tendonitis. You may also be unable to move the affected joints. So runner's knee refers to knee pain that starts behind or around your kneecap. So behind or around, okay, the kneecap. This condition is commonly in active adults. So the symptoms include a dull or throbbing pain behind your kneecap, or runner's knee can also cause your knee to pop and grind. Okay. Then you have a torn ligament. So what is a torn ligament? A torn ligament is okay. So it's common injured ligaments in your knees are the anterior cruciate ligament, which is behind, in between the two big joints. And this is the, as you can see here, the anterior cruciate ligament is the one in front, and then at the back you have yet another one, which is the posterior cruciate ligament. Okay. Okay, medial collateral. This is, and also it also commonly occurs on this ligament here as well, the medial collateral ligament. These ligaments are prone to get torn, particularly in those people who do a lot of sports, who put excessive movements around the knee area. Okay. Then the next condition is called osteoarthritis. So sudden knee pain could indicate the onset of osteoarthritis. It is the most common type of arthritis. So older people, especially athletes, people in trades like construction, who often perform repetitive movements, are most at risk for this condition. So when this happens, you can experience pain, tenderness, inflammation of the knees are signs that osteoarthritis is beginning to develop. Okay. In most cases, the pain in your knees won't present suddenly. More likely, it will cause gradual increasing level of pain. Okay. Then you have bursitis. So bursitis a bursa or a bursae, some would say, are fluid-filled sacs between your joints. So normally in the knee area, it's so these bursae or fluid sacs can become inflamed around your knees, causing bursitis. Repeatedly bending your knees or bleeding in your bursae can cause a sudden onset of bursitis symptoms. Bursitis of the knee isn't one of the most common places for this condition to occur, but it isn't rare either. Acute pain and swelling in one or both knees are the most common symptoms of bursitis. And then we have injured meniscus. So meniscus are these blue pieces in between the joints. Okay. So meniscus is a common torn meniscus is a common condition that results from forcibly twisting your knees. If you injure your meniscus, you may hear a popping sound followed by immediate sharp pain as well as swelling. The affected knee might feel locked into place. This condition tends to affect only one knee at a time. And then there's gout. Gout occurs when there's a buildup of uric acid in the body. Okay? The acid tends to collect in your feet, but it can also affect your knees. Gout is very common, especially for middle-aged men and postmenopausal women. The condition causes intense pain and a lot of swelling. Gout comes in spurts that last for a few days. If you never had knee pain before it comes on suddenly, it could be the beginning of a gout. And then the last one is infectious arthritis, which is quite uncommon, but it can still occur in some people. Infectious arthritis is an acute form of arthritis that develops from infected fluids surrounding your joints. If left untreated, the fluid can become septic, which means, dirty and needs to be cleaned. So septic arthritis is considered a medical emergency that requires emergency surgery. This condition causes sudden pain in only one knee. Having a history of arthritis, gout, or a weakened immune system can increase your risk for infectious arthritis. Of the different knee conditions that you can have, and also the structures that are involved in these different types of knee conditions or knee pains. All right. Now let's look at the TCM's or the traditional Chinese medicine's perspective on knee pain. All right. So of course, let's start with the human model, because in Chinese medicine, as you know, or most of you will probably heard of the meridian system. We always talk about the meridians when we are diagnosing patients. Okay, so let's have a look around the knee area. Okay, so you can see there are meridians running along and around the knee area. Okay, so when we as TCM practitioners or Chinese medicine practitioners, when we get a patient with knee pain, the first thing we'll probably ask is, okay, where is the knee pain? Is it at the front, on the side, or at the back? Okay, which part is sore? Because that tells us, well, which meridian is actually involved in the knee pain. Okay, for example, if say, for example, the knee pain is behind the knees, okay, it's mostly likely to be involved to be the bladder meridian or the kidney meridian that is involved. Okay, so maybe there's a blockage in the bladder meridian or the kidney meridian. We don't know, and then from then on we'll ask, okay, do you have any other symptoms? For example, night urination, or what is the quality of your pain? Is it a dull pain or is it chronic? Does it how long does it last? If it's a dull ache and it lasts for a long time, we'll begin to think, well, okay, maybe it's to do with the kidney, because kidney is associated with knee pain very often. Okay, and then we also look at history of osteoporosis, because that can further indicate, the bones are weaker, and kidney is associated with the bones as well. If the bones are not well, then we have to think, okay, maybe the kidney meridian is not doing well. Okay. Okay, so other than that, if say for example, if the knee pain is at the front, we'll start to think, if it's on the kneecap, our train of thought is, okay, so this is the stomach meridian that runs up here, past the knee. So maybe it's associated with the stomach meridian, or if it's on the side of the knee more, then this is where the gallbladder meridian runs through. Okay, so these are one way of how we diagnose knee pain. Okay, so of course, any conditions of the body, it doesn't matter where it exists, cannot escape what I'm trying to say is any conditions that exist in the body also has to do with the organs as well, because the organs are, in Chinese medicine we say that the organs are connected to your muscles, your tendons, your ligaments, and your skin, your hair. So everything is connected to organs. So say for example you have hair loss, then we start to think, okay, which organ is that? Maybe it's kidney, because the kidney also governs, hair growth. Okay, so how about for knees? So if we have knee problems or knee pains, then we also start to think about spleen and stomach, because spleen and stomach governs the muscles. So if you have weak muscles, then you're more prone to muscle injuries when you're exercising or when you are doing sports. Okay, so that's one possibility. Or if you had a knee injury that doesn't actually heal for a long time. Okay, so it's always, you had an injury, you sprained it or you twisted it, and then after half a year it's still not well. Then we have to consider, okay, maybe the spleen and stomach functions are weak, so that prevents you from healing properly. So then when treating the disease, when treating your knee pain, we have to strengthen it. It could be due to the heart as well, because the heart and small intestine, the heart, for example, is in charge of pumping the blood around your body. So if the heart is not strong, this heart meridian is weak, then that means your circulation is also not good. Your circulation is not good, then that affects your knees. So maybe causing some blockages in your knees, or it can prevent the knee injury from healing properly as well. Okay? Or if it's related to kidney or the bladder, because as I said before, the kidney is related to the growth of the bone, the strength of the bones in your body. So if you have a history of osteoporosis or cavities, or you have fractures, your bone fractures or breaks very easily, then that's the thing to look out for. Maybe it's a condition of the kidney or in the bladder. Okay, so we need to consider these when we are treating a patient, not just looking at the physical structure of the knees. I know that's important as well, but you cannot ignore the connections that the internal organs have with the external body. Okay, so that's very important. Okay, have I missed anything else? Okay. Okay, so thank you very much for listening in, and this is the talk on knee pain. So for those who are listening to this broadcast, if you have any questions at the moment, you can ask me. To give you some time to respond or to think of your question, to generate your questions. Okay, this is Kim from Central Balance. If you have any problem, please give us a call. And that's it. Bye.